Hey, good morning, everybody. This is Brittany with the Seniors Blue Book, and this morning I am live with Melanie from InTelicare Health Services. Good morning.
Good morning.
We are socially distancing over at Benderson Park, as you can see behind me. And all around, it's a beautiful morning here in Sarasota. So we are going to talk about home health this morning and just talk about some of the services that InTelicare brings to the area. But first, let's get to know Melanie a little bit. A lot of people out there know your face, but let's talk about you and just a little bit of your background in healthcare.
I'm Melanie Mora. I live in Venice. I've been a nurse for 20 years. I've been doing home health, I would say, for the last 12 years. My home is InTelicare Home Care. What else do we want to know about me?
So
three.
There it is. I was going to say, so family-wise, like you're a mom of three, you've got kids in college.
3 kids in college.
Though she looks like she's in her maybe early 20s. Just saying.
Thank you. Thank you.
So tell us a little bit with InTelicare, like what areas do you guys cover? And InTelicare is a Medicare home health company, of course. So we'll talk about the area you cover and then some of the services that you provide.
Well, we have 2 separate offices in this area. We have one in Ellington, and then we have one in Offspray. The office I work for is out of the Offspray area, so we cover from Lakewood Ranch, the Sarasota line, all the way down to Naples. We are a Medicare agency, which means that we're primary Medicare. However, we are working on a few insurance contracts because of COVID. There's been a little bit of a delay on those, but I would foresee by the end of the year having a few of them that will be able to service those patients also.
Awesome. And so typical process for home health, and so for those that are watching, again, tuning in now, this is Melanie with InTelicare. So we're talking about home health, and a lot of people do get confused on Medicare home health versus private duty, the services, because the services can be kind of similar in a fashion, or at least they overlap in the sense of there's skilled nursing. So there is a nurse who comes out to the house and will do, let's say, medication management, or they're basically managing a chronic illness, wound care, those types of things. But what's the other side of Medicare home health?
Well, of course, the patients need to be homebound. They need to have difficulty getting out to outpatient services. That being said, we work along with private duty to they accommodate our services if you need any help outside of the realm of what we can provide. We do, wound care, IVs, medication management, therapy, occupational therapy, physical therapy, speech therapy, all these Medicare covered services. When the patients need extra things that private duty covers, then we involve them with our care.
Awesome. And so let's say a typical patient of yours may come from either the hospital, maybe they're already at home and their physician has ordered it. What's the process for somebody if, let's say, they're having a decline, they're at home and they're having a decline? Do they go see their doctor to get an order for home health, or how does that process work?
Well, we need a physician's order to start services and a signing physician who will continue to follow the patient. But certainly the patients or the family members can reach out to our agency and ask for assistance also. We can be the one to initiate the phone conversation with the physician and help them set up an appointment to get in so the doctor can review and see what their needs are. So either way, they can go to their doctor's office and ask for services, or their doctor will evaluate and see that they have a need, or they can reach out to us or call me and I can do that legwork for them.
Awesome. And so talking about the C word, the COVID word, has anything for you that you've kind of seen over the last 7 months, has anything kind of changed in the home health world, or have things gotten busier that you've seen because people are, trying to stay at home and trying to stay safe? But what have you kind of seen out there with home health?
Well, at first when there was a lot of confusion with a lot of what was going on, and, I think the media was giving us all kinds of mixed stuff. A lot of patients were scared and they didn't want people in their homes. But of course we put together all different kind of extra protocols
guys are doing a phenomenal job putting all the safety protocols in place. Again, this is Melanie with InTelicare. If you are watching and you do need home health services, they are an amazing company here in town. Again, providing skilled nursing, therapy services such as PT, OT, ST. And again, you can just call Melanie. I'll put her phone number in this post. You can reach out to Melanie to get that process started if you are somebody who's in need of that or you know somebody who is. And Melanie, I want to say thank you for joining me today at the lovely Benderson Park.
Thank you for having me.
All right, everybody who's tuned in, thank you so much and have a wonderful day. Perfect.